if you combine symptoms with specific abdominal pattern, you get the formula. There is a formula that fits that.
Hi everyone, and welcome to Shinto University. My name is Maya Suzuki, and I am the owner and founder of Shinto University, the best online foundation for a lifetime membership to learn Japanese acupuncture, moxibustion, theory, culture, history, everything you want to know. That also has a built-in mentorship program and in-person learning classes for advanced learners. Today's interview is with Dr. Butch Levy, who is not only a Western medicine practitioner, he's actually a Western doctor, but he is also an acupuncturist, moxibustionist, and herbal therapist. He is an incredible practitioner who has been extremely generous with his knowledge that he learned directly from Mikishima sensei, as he was one of his main students. Without further ado, I'd like to get into the interview. If you're new here, please don't forget to like, subscribe, hit that little bell for when we get new videos in. I'd love for you to get this information directly to you for free, so whenever I get it out, so make sure to subscribe to get that. And then of course, if you find value in this knowledge, please share it with someone who you think might find value in it as well. The whole point of doing this YouTube channel is that for acupuncturists around the world to be able to figure out why Japanese acupuncture is so amazing, and how little things like proper technique, proper stance while needling or doing moxibustion, using the correct tools, how these little things can really build up into an awesome foundation that can support your practice no matter what style you're using, even if it's not Japanese acupuncture. So without further ado, I'm going to get into the interview. If you would like, please go to shinkyuuni.com for more information about my course, also linked in the description below. And then finally, this is a bit of a lengthy conversation with Dr. Butch Levy. He drops so many truth bombs all along the way, which is why I didn't edit it down to a nice 10 or 15 minute nice video. So if you need to, just put it on your headphones and listen to it in your drive. I don't mind at all. But it's such a good conversation, so I really do recommend watching all the way to the end. So without further ado, let's get into it. These specific interviews that I'm doing with this set of questions, which is what brought you to Japanese acupuncture, why do you practice Japanese acupuncture instead of a different style, and then what is Japanese acupuncture to you? I'm asking those specific questions to Japanese practitioners, Japanese style practitioners across the world. And my goal with it is to put this information for free on my YouTube channel so that other acupuncturists can kind of understand the scope of what Japanese acupuncture is and what it encompasses, and then who's out there that they should be learning from, and just give them a free source of information. Because I find before I started my university, I did about 50 different interviews with various levels of practitioners, TCM, 5-element, Japanese, all of the range. And everyone told me the same thing, which is, it's really hard to understand what Japanese acupuncture is. Like, what does it encompass? Is Japanese acupuncture just like, sorry, go ahead.
Well, I was going to say that's the inherent problem is, as Mickey always told me, Chinese acupuncture, you think about Japanese acupuncture, you practice.
Exactly.
And I think more of my contemplation this week came up with the idea that, the NCCAOM doesn't even include this as part of their certification training. So there's no obligation for a school to even teach it because it's very biased. They don't offer Korean. They don't offer any, their concept of Oriental medicine is, TCM is not even Oriental medicine. It's kind of a form of Chinese medicine that was practiced after the intellectuals that were really practicing were all killed. So it's kind of a misnomer. Exactly. I also thought that, when people are being trained, when you do medical stuff, you have to take 3 sets of boards. You take one set after your didactic, and you take one set after you've been in the hospital as a student at the end of your time. And then I think you take another one when you're done with your internship so you can show clinical competence. And I don't think the board really offers, they don't require practitioners to do anything that shows that, you know, my last set of boards and my recertifications are like, here's a case, da 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 da. How would you handle this? And I think there's a great loss of the ability of students to actually be tested. And then the other thing that I think is interesting is you've lived in Japan. I mean, you have a sensei. You don't just finish your training and you go off on your own like American egoists do. It's like you finish your training in the United States, like, oh, I'm an acupuncturist now. It's like, really? That was the aspect, what I felt was going on. I always felt my training was, TCM school was education, and my training really began when I had a mentor, when I had Dr. Shima. I started with him while I was in school, and I also did the American Academy of Medical Acupuncture. I said, oh, I should probably do that because I'm a doctor, and you know, what they taught was you had a weekend course and then they sent you home with tapes to learn where the acupuncture points were.
Oh, gosh.
And then you came back and they had formulas. If it was this, you did this plus that, and that's how you treated it. And, you know, that didn't move me very much, you know, and TCM school was the people that were teaching when I was in school in Colorado were people that had graduated a couple of years ahead of me. So they had a couple Chinese doctors that I think were trying to get into this country and were teaching there for a pittance. And they were really herbalists, which, you know, I think is something that more of the practitioners in China are trained better to do, is they know herbs, they don't know acupuncture. So I just thought it was really limiting, and I wasn't very comfortable with what was going on. And I went to one of my friends was going out to Mickey's class, and I went out, and his whole approach was so different. It was hands-on. He showed you what he was doing. I mean, it's hard to remember exactly, but I think I went to weekends probably every 3 months for like 2 or 3 years. I probably did 12 or 14 weekend seminars. And then he thought I was, you know, he kind of said, you know, people that come out here, Americans just want to be spoon-fed. And, you know, I don't make friends with anybody because I don't think they're really serious. And he said, you've kind of shown that you've shown a level of seriousness, so I'm willing to, you know, kind of at least assume that you want to learn things. So, you know, I think that was a part of it in that regard. And, you know, just over time, he had a practice where he trained Western doctors to do acupuncture in his office.
Really?
Herbs, and they one day a week had to go through the internal medicine textbook with him. So he went to medical school, but he was so hyper that he made himself sick and he had to drop out.
Really? I didn't know that.
Yeah, his sister was an acupuncturist, and he left medical school and went off to a monastery for a while and just kind of chilled a little bit and decided he would do acupuncture. But when he finished his training, he realized, as most people would in Japan, once you go into a school, you're there. That's what you do. You don't change. And he got kind of bored. So he decided he would go to America. And when he came to America, he started doing shiatsu first. And he went to LA, and he worked in a Western clinic doing herbs and acupuncture, but this was in like 1970. There were no other acupuncturists. There were no other herbalists. So he was so busy, he didn't know what to do with it all. It was, you know, he was really, really busy. And then once he established himself and he went back to Japan, he was like the returning hero, and all of the schools wanted to show him how good they were and what they offered. And he said, I stole everything I could. And he brought it back. Now, his teacher, you know who Dr. Otsuka is, the herbalist. He was the great MD. His son-in-law was Mickey's herbal teacher. And,
Oh.
and Dr. Ire in Dr. Monica's group, who wrote the initial books on channel divergence and 8 extra vessels, was his acupuncture teacher. So he developed the concepts of channel divergence and 8 extras to a really high level. That's what I primarily practice. And I was thinking about that. It's kind of like, instead of just doing a meridian style acupuncture, what I've learned is that you can access the yuan qi. You know, you can do vertical, horizontal, inside, outside, and you can do the organ systems. So I found it to be, for me at least, it worked really, really well. And having somebody available, I felt that to be, you know, I have a binder. I would think, you know, for 15 years, every time I had a case, I would send Mickey a short email about this is what I'm doing. And Mickey would send me an email and say, that sounds really good, but why don't you try this? You know, or here's another suggestion. So I have all these emails, and we started just becoming friends. And then I used to go to workshops and I would assist him. I would, you know, white boy carried his bag, you know, I brought the needles, I did the stuff. And then after a while, he would say, we're going to do this today. And Dr. Levy will demonstrate that on you. And then, you know, I would start doing stuff. And then we started teaching together. Then we kind of said, we should integrate Western and Eastern medicine. We did 2 or 3 joint seminars together for a weekend in Boulder. We did one on called The Woman's Hormonal Journey, and we did one on GI disease. And then I remember he had a seminar set up on pulmonary disease, and he decided he did that so that I could teach it. So I ended up teaching the whole seminar, and you know, and then I think I was the only person he let go out to his clinic. I'd go out to his clinic, and you know, in those days we were a lot more rowdy, and you know, we would go out and drink and eat sushi and talk. But I'd go to a seminar with him, and we would teach together, but we would stay together. So the seminar would go on for 8 hours, and then we'd go have dinner, and we would talk about what we had done for another 3 or 4 hours. So we would, you know, and I would go, well, I didn't understand this concept. And he'd go, this is what I was doing. And, you know, so I think that part of the reason it became so ingrained is I learned I understood both practical applications, but I got a much broader picture of what was going on in terms of how to do things.
So I'm curious. So how long did you actually study with Mikishima? When did you start, and when did your apprenticeship?
I probably started in like 1990, 1991. Mickey retired about 5 years ago. He was having some both physical and mental health problems, and he doesn't really do anything. And that's what happened. What happened was he kind of said, you know, all of the information I've taught, it's yours. And that was one of the aspects of Mickey. He had no ego about telling you something or giving you something or helping you with something. He just said, take all the material. And he said, you should go out and start teaching this stuff, because there isn't anybody that really wants to do this stuff. And I kind of have felt an obligation. I was teaching more before COVID and finding other sources, but you know, I really feel like if acupuncturists don't broaden their scope and learn how to, you know, if they don't learn how to use their hands and feel and palpate and do stuff, it's not going to be a viable practice. And I think the other thing that's really important is I think practitioners of Chinese medicine really need to learn how to understand Western medicine better,
Yes.
and how to do supplement functional naturopathic, in all my courses, I talk to practitioners about get the patient's chart, get the records, like read what the doctor's thinking so you can understand how a Western doctor thinks about what you're going to be dealing with, and then see how that paradigm fits with yours and how to mold them and blend them so that you get that perspective. And they, it's a difficult thing to try to get people to do. So, I mean,
Well, I think you bring up a extremely interesting point that I honestly hadn't thought of from that perspective, because in Japan, there's a huge push to Westernize the acupuncture there. And so in my 3 years of learning acupuncture in Japan, I would say maybe 45% of it was learning Western medicine. Definitely, I mean, the rest of it was all hands-on technique for the most part. Maybe it was spliced in with theory, but a lot of in-depth understanding of pathogens and disease and how Western medicine practitioners talk and think and walk. And I still remember one of the first days of class, one of my teachers told me, you're going to have to speak their language, meaning the Western doctors, physical therapists, you're going to have to speak their language. Don't ever expect them to speak your language, meaning the language of Eastern medicine, because they are never going to be able to do it. You're going to have to
understand it.
Yeah, and they're not going to understand it. And even taking that a step further, it's funny because I was just teaching moxibustion in the school downtown at Colorado CSTCM down here. And I just finished telling those students, you have to explain what you're doing to your patients in simple Western medical terms. Like you have to tell them moxa works because of how it's affecting your blood and your immune system. Because when you start, you can add in the Eastern medicine side at the end of it. But if you start just talking to them in Eastern medical jargon, your patient's eyes are going to glaze over. You're going to lose them in 2 seconds, and they're not going to understand what you're doing at all. And I think it's such a good point that we need to train the acupuncturists around the world to speak and understand Western medicine more, despite the fact that that's not what they're practicing.
Well, because that is the dominant form of healthcare. And, it's very interesting that you will find that some will be interested, but many won't. But if you can present it to them in a way, when I talk to them a great deal, I had one of my daughter's friends had Hodgkin's disease, and I called her doctor up. I said, look, I know you're going to give her chemotherapy. I knew what was going on. And I said, look, all I'm going to do is support this person. I'm going to do it in a way that doesn't interfere with what you're doing. It's not going to cause any undue effects that will make her sicker. And I'm going to try to make it that she can get through your protocol healthier and feel better when she's done. So when I talk to students about, I used to talk about it being integrative oncology. And now I just say it's supportive care of cancer. And, when you talk to people, I tell people, look, I would like to support you during chemotherapy and then restore you and rejuvenate you when you're done with your chemotherapy. It's as simple as that. And how we do that is, lifestyle, plant-based herbs, acupuncture to alter the energy. Mickey spoke 7 languages, by the way. He was a linguist by background. He had a master's in French. He came to America to get his master's in French in Michigan. And because he was an acupuncturist, he started treating all these people, and they were all getting better, like in the 60s. And the medical board in Michigan said, we think it's time for you to leave Michigan. So he said, okay, I'll go. The other aspects that I found to be fascinating, which it's easy to look back and compare, but, when I teach this stuff, it's difficult for some TCM practitioners when you start telling them that you have a hole with a vector that you have to find by palpating it, and you need to bring the chi energy to your finger and find the energetic.
Yes.
People don't get that very clearly in terms of what's going on. And the techniques are, Mickey offered a class, I think he offered it for a year. He had there were like 10 or 12 of us that he taught. Every couple months, he wanted to certify us for the Japanese Acupuncture Foundation. So he had other teachers at the time. This never came to fruition,
Okay.
but he really went out of his way to make sure that we understood. We did the Sugiyama
Mhm.
17 techniques, and how do you do all these needlings, and you don't do perpendicular needling, and it was a whole different flavor of what
Yes.
was going on.
Well, I mean, I mean, so the university that I just recently started, Shinto University, is essentially to do the same thing that it sounds like Mikishima was trying to do, which is try to get as many acupuncturists as possible, these fundamental Japanese acupuncture skills, the Sugiyama style of acupuncture, as well as moxibustion. And then I also teach one free needle technique that I learned in school called Nenshin, which is, if you've ever seen Shudo Sensei's SRT technique, it's basically that, except for
Right.
he's some
Right.
embellishment on SRT. But I mean, I agree 100% with what Mikishima was trying to do, in that you need to have this basic understanding of palpation and technical skill in order to really advance in Japanese acupuncture and really to understand the knowledge. And I would dare say that even if you just picked up the technical and palpation skills of the Japanese acupuncture techniques, that even if you did Chinese, straight Chinese or TCM with it, that you would get better results.
Definitely. I mean, the other thing I've never seen a TCM practitioner do is, after they put the needles in, go back and take the pulses.
Yeah, which is it's amazing to watch that information change.
Yes. And it's all about data and information and being able to change and flow. And I think that's part of the problem, is when you go to a TCM school and they teach you how to pass an exam, you're kind of within a real limited range of what you can do. I learned more about the illnesses I was treating because I was in a practice where in primary care, I was diagnosing people with rheumatoid and lupus and cancers, and I would send them to their doctors and they would come back and they looked like somebody beat them. And I just said, well, I know how to do this stuff. Why, instead of doing pain and, why don't I start doing some of this stuff? So it's just so interesting that part of it was just the development of it, being able to extend what I had learned to other diseases, because it's really, as Mickey always said, that the disease is treatment and the treatment is the disease. So you get down to, you don't have to have a diagnosis. You have to be able to see what's imbalanced.
Yes.
That's why. And
Yes.
that's what they don't get. The TCM people want to have yin deficient heat. They want to have damp heat. It's like, what's wrong with them? It's like, well, kind of feels like their kidneys are weak, and they need, they probably need to be warmed, or they have these things that are out of balance. It's not like I can necessarily, well, where did that come? Well, I don't really know. But,
Exactly.
I do a lot of very, now my practice is a lot of consulting work, but I deal with a lot of people that have Lyme and mold, and it's, and I think herbs have a real place there. I think all of it together has a very different kind of feel. I mean, you've been to China, I assume. So,
I actually have not. I
well,
have never.
okay. Well, the sophistication of Japan is so much more, in some ways, different than China. In some ways not. But the last time we went with Mickey, my wife went, and she has very severe celiac disease. So we ended up eating Japanese breakfasts, and we would go to the high-end department stores in the afternoon and buy sushi so we could eat dinner, because didn't matter where we went. It was all wheat noodles. And I would go to places and ask if they would substitute tamari for soy. I said, oh no, we can't change the recipe. We make the recipe with soy sauce. And it's like, well, couldn't eat that. So,
It's very difficult for those with dietary restrictions in Japan.
very much so.
Very, very restrictive. And, like just going back to your point, and then I'd love to ask you a little bit about your new Kampo book that you're coming out with, because I'd really love to learn more about it. But when I came back from Japan and immigrated at the end of 2015 with my family, I had to go to acupuncture school for 2 semesters because I had a decade's worth of clinical experience, but according to NCCOM, I didn't have enough supervised clinical experience. So I went back and I had to be in the clinic and classes a little bit. And we would be sitting at the round table discussing cases at the end of each treatment. And every student would be like, they have liver excess and kidney deficiency and spleen, this, and it would be my turn. And I'd be like, their lower jiao was cold and they had Taiyang heat. And so I just, I did a little bit here and a little bit there, and they seemed to feel better. So I think it worked. It was just, I would get red-faced and embarrassed because I had a very hard time speaking in their language. It took me a long time to speak in that TCM language so they could understand what I was doing.
Yeah.
But when you say it so accurately, it's just like, well, they're a little deficient. If they're deficient, tonify it. If they're excess, disperse. If it's cold, warm it. And if it's too hot, cool it down. What else can you do? And that's something that, and when you go back to the diagnosis bit, something my teacher of my group, Iashinomichi Yokota Kampu sensei, says all the time is that people get so attached to their diagnosis, and it almost, that in itself, as you said, becomes the disease because they're so attached to having celiac or being kidney yin deficient, like it's not productive sometimes.
Well, the other aspect that I find is if you come to somebody's office and they say they have rheumatoid arthritis, you're already boxed them in, but it doesn't tell you whether it's severe disease or what joints or what they're taking, so it's kind of, if people come and say, well, I'm yin deficient, it's like, well, where? Where are you yin deficient? In your kidneys, in your spleen, in your stomach? I mean,
right?
No, what I try to do is at least take the data that I get from what I feel and then decide on what needs to be done. And it changes every time you see someone,
Right.
So, it's always been very interesting. Do you do much 8 extra vessels?
To be honest, I don't, just because my group, so Iashinomichi is based on the teachings of Yokota Kampu, who, much like Mikishima, trained in Japan, looked for his teacher. Unfortunately, unlike Mikishima, was never able to find a teacher because the person he was supposed to study with was a Buddhist monk, and he became an apprentice, and then that monk unfortunately passed away. And so he, through his own personal battle with disease, he ended up understanding the medicine, which is, I think, something that many of us do. And his approach is a little bit multifaceted, of course, understanding the meridians, but also heavily utilizing the Shang Hanlun. Although acupuncturists in Japan are not able to prescribe the herbal formulas,
Right.
We might offhand be like, oh, well, this formula might be really nice for you, and that pharmacy down the street might sell it, so we might suggest it. But moreover than that, it's a way that we also communicate, again, specifically what's happening in the person. Like if you say to someone, oh, they presented with Guizhou tongue, it's so easy to understand exactly what's happening in the body. Where is the cold deficient? Where is the excess heat? Where is the jaki? What stage in illness are they? And then you're able to, with just saying Guizhou tongue, okay, well, that means exactly that you're doing this basic treatment and approaching the body by, again, that basic principle, disperse the excess, tonify the deficiency, etc. So we use that, another Japanese classic, and then Yokota Kampu's kind of basis for how he fought his own illness. Kind of a long-winded explanation to your question, but it brings me to my question, which is, I'd love to hear more about your new book. I know you've already written a book on the Shang Hanlun, which I'm excited to read. but I'm really excited to hear about your new book and kind of how you approach the material and how you're going to present it.
Well, the material is stuff that was all taught to me. I made it very clear in the books that this is just a way of giving my deference to Mickey and what he taught me. And obviously none of us have invented anything.
Oh, nothing at all.
It's just passed down. And so since Mickey really isn't able anymore to actually put this stuff out, and really probably he couldn't teach it. And he has trouble with remembering a lot of it now and doesn't want to. So I just have years of notes. I have stacks and stacks of notes from all of his things. I have all kinds of stuff. And, so what I did is I put together my idea. The first book is a little tiny little book because I thought it'd be fun to describe how people should do the abdominal exam. How to do massage on the belly, and then how the different areas of the abdomen, when you examine them, have different levels of muscle tension. And when you find those under the ribs, suprapubically, the umbilicus, along the gutters of the abdomen, and there's little drawings that always go with that, that signifies a principal herb that usually is what you use. And then, what you do is there could be a whole family of that principal herb that you would use. That's kind of what the gist of it was. And I gave a couple examples of, if you had subcostal tightness and chai hu is the principal herb, maybe you would want to use such and such. And then I kind of gave a reference to the Shang Lun where you could find out about that formula if you wanted to read about it. And also where to find it in Sun Ten and Brion's commonly used Chinese herbs with illustrations that have a picture of it, which is what you go by. If you're feeling somebody and you can look at a picture, you go, oh yeah, they have that confirmation. So in Kampo, if you combine symptoms with specific abdominal pattern, you get the formula. There is a formula that fits that. So what I did this second round was I included the abdominal exam, and then for each of the types of patterns, I had a number of seminars from Mickey that had all the different formulas that would go with that pattern. So instead of going, you have subcostal tightness, which you probably don't just see alone, you see it with other combinations. So I basically said, okay, if you have subcostal tightness, these are some of the variations you will see. If you see subcostal tightness and in the lower abdomen, you feel like you have blood stagnation or deficiency, you might use Shiao-san or Jaiwei Shiao-san. And so what it does is it gives you how an abdominal picture would be with a specific principal herb, and then several of the different formulas that would go with different types of patterns that match up, so that when you see it, you're not left with one thing you can do, you're left with. So what I do is, even still today, it's like, oh, they have this pattern. I think it might be this, and I'll go to my notes and I'll look and go, I think it could be this based on the symptoms and the pattern. And then I'll look at the textbook on it and go, yeah, that's what I want to use. So it's much more a way to actually make a more specific diagnosis. And then
just to cut you off, Butch, real quick, I have to say, you have created an amazing, if it is what you're describing, which I'm sure it is, you've essentially created the Cliff Notes for Kampo diagnosis. I mean, I hate to say it because I don't like the title, but Kampo for Dummies. You can look at it, see the palpation, and be like, yeah, it's going to be this main herb with these diagnoses. Which one's going to match up? I mean, that's an amazing resource for practitioners.
Well, that's why I really felt I couldn't let this all just disappear because Mickey doesn't offer it anymore. He hasn't taught it in years, and I had all the stuff, and I just went, how can I honor him?
Right.
In a way, and that's what the book is about. And then what he did is he took the Shang Lun and he took every Western medicine subcategory. He took cardiology, And he went, okay, Tai Yang, Xiao Yang, Yang Ming. Here are 2 or 3 formulas in each cardiovascular category of each one of those stages of the Shang Lun that would work for this type of cardiovascular disease if they have that stage.
That's amazing. I mean, so the Shang Lun that my group uses is translated by Yokota Kampo sensei, because like I can't read traditional Japanese, no way.
Right.
So he translated into modern Japanese, but it's the same thing that you're saying with each of the diagnosis. There's then an abdominal and a full body pattern drawing. So that way you can visually see and not just read what's happening to the patient. And then for Mikishima sensei to go and then break it down even farther into those specific, okay, if you have heart disease in these patterns at this level.
Well, he doesn't really go into the patterns as much as the Shang Lun stage. So
Well,
if you had a respiratory problem and it was in Tai Yin, he would give, I have a list of 3 or 4 formulas that fit that.
right.
So if
Well, that's so
you're
easy.
cold and you're tired and you want to sleep all the time and you have a respiratory problem, oh, one of these formulas might work.
It's amazing. I mean, it's the cliff notes for Kampo and Shang Lun formulas. I mean, I think even TCM herbalists, and of which I know many, would benefit so much from that book. I mean,
And it's one of the lost things that Western schools don't offer is the Shang Lun or the Jingwei.
exactly. Well, and let's say it even one step farther, they also don't offer the palpation to actually accurately diagnose which formula of those 2 books you should go to. You know, it's all based on the tongue and pulse, and maybe more so the tongue and a theoretical understanding of what's happening inside the body that you haven't really touched.
Yeah, unless you're blind, and then the tongue doesn't work very well.
Exactly.
I mean, people are just, people are always astounded, and I come in and, I see people and, I'll palpate their legs and palpate their abdomen and just, it's like, by the time you're done with the exam, it's like, oh, they have really cold digestion and it's quite obvious they have a lot of heat in this. And the other thing is you can use all 3 fingers to do 8 extra vessel pulses.
Interesting.
Yeah.
Very interesting.
If you'd like, I'll send you my PowerPoint if you want to look at the 8 extra vessels.
I'd love to look at that. And, I mean, just as we're nearing the end of our hour, I'd like to wrap it up a little bit in saying, first of all, I'm amazed and I just have a lot of gratitude that you took this time to really talk about your approach of the medicine and to share about your book, because I know a lot of people who watch my channel on YouTube could greatly benefit from the material that you're putting forth. I mean, what I teach in Shinkyu University is really the basics, historical understanding, the cultural understanding of ki within Japan, basic techniques of acupuncture and moxibustion, the basic hara palpation, and then refinement with it going forward. And my whole idea is that people will get this foundation so then they could go and learn from someone like yourself and say, okay, you already know how to palpate. You already know how to needle. Let's apply this. Now let's have fun with this clinical diagnosis. Let's learn more about the Shang Lun in these different stages. And
I think that's really important to do. Mickey taught a class on the Shang Lun. He did it every 3 months for 2 years. He did a weekend. So I learned a great deal of the Shang Lun by him kind of distilling it down to talk about it. And then one Christmas, he said, well, what can I send you for a Christmas present? We used to exchange New Year's gifts and, we would have fun that way. And he said, what do you want to do? I said, what I really want to do is, would you be willing to teach me the Jingwei? So once a month, we would go through a chapter of the Jingwei and he would talk about it. It was years ago and I remember some of it, but I think what it requires is that, people need to have somebody that they can talk to about, what do I do next?
Yes,
I mean,
mentorship. Yes.
I understand a lot of medicine, and I was a primary care doc, but I needed an anchor to be able to call someone and say, I have this guy with his shoulder, and I think he's done this. And the guy would go, well, I think you ought to do this and this and get an MRI, and then I can see him if he's done something. You have to be willing to go to the next level and go, I don't know this, what do I do? And I would do that. I'd go to Mickey's office, and, he would say, we'd spend the day, and he'd go, whatever you can steal today, you can have. I'm not teaching you anything. And then, I
But
would go in there.
Yes. Yes, but that's how you learn in Japanese acupuncture is look at what I'm doing, and whatever you can remember, it's yours.
That's right. And he would, we would go through something, and we would see a patient, and I would know the patient because I had been there before, and he'd be doing one thing, and the next time he'd do something different. I went, you did this and this. He goes, oh, you finally caught it, huh? And that was the secret of what he did. He never allowed himself to be, the other thing you would really appreciate. Did you do Akabani when you were?
I've done, I went to one study group when I was still trying to figure out what I wanted to really focus on. And so I went to one Akabane study group in Japan.
And you did
but just
Akabani? You did
just one. And it was actually quite different from what Mikishima did, because I was kind of introduced to that a little bit while I was in school back in SWAC when I went to school for that 2 semesters. It was a little different. So I'm not sure if the Akabane has gone forward from what he does, or I'm not sure of the history there with the group.
Well, he really, he did the Jingwell points with the incense, Akabani. But what Mickey developed is he developed an algorithm where you could add up all the numbers for all of the different points and plug it in, and you'd know what channel divergent and what 8 extra vessel to use.
That's
So,
amazing.
So I would go to a class, and I would be doing the 8 extras, and then I would do the Akabanis, and I could compare what I was doing to know if I was kind of doing it correctly. And, I would come back from his seminars, and my staff would go, oh God, it's going to be 2 hours with patients now, because you're going to be practicing all this stuff,
But but that's how it is. That's the first, anytime you come back, you've learned something new, or your first year really in practice. I remember shadowing this one practitioner in Japan when I was still an apprentice, before I even went to school, named Komatsu Sensei. And he was an older gentleman in his second career, became an acupuncturist. He was in clinic, and he was his first patient, and he had glasses, short, clear cut guy, really clean cut. And he came out of the room sweating. You would think he had just gotten into a bath. His eyeglasses were so steamed up, and he was just like, I need to figure it out. He was all into Nagano style was his practice. He was all about Nagano style. And my goodness, it was the first time I think I ever understood the amount of effort and stress and anxiety, and on top of that, the amount of fun you can have when you're practicing something when I want to say in real life, I guess, on an actual patient.
Yeah.
Right.
Yeah.
It's exciting, and at the same time super stressful. Yeah.
It is. I mean, you're trying to do the best you can for someone and help them in some way. And, it can be really, you can really get down on yourself for not being able to, make a correction or do something different. I did Mickey's book because I thought, I wanted to do this for Mickey. It's like, this is, and it's very clearly stated that it's his stuff. And it's like, use it. It's not meant to be held back that, some people, in China, if you have a family dynamic where you've been handed something down for generations, you don't give that stuff out. You make your money by being able to be special in that regard. So it's, and Mickey told me stories about when he was done in Japan, going to work with a practitioner in Taipei, Dr. Ma. Even though he studied in Japan, he went to China, he went to Taiwan, and Mr. Ma or Dr. Ma would see 120 patients a day, and it would be $1 a piece. And you gave him no symptoms. He took your pulse. You had all your students around. He would take the pulse and say what it was, and then say, send them down for this formula. And he
Yeah.
did that for a year. And he said, at the end of the day, we would all try to combine our notes and see what we came up with so we could figure out, I mean, that's part of the problem is if you don't see a number of patients or you don't have cases. I think the cases are probably really important. When I do seminars, and Mickey did it, that's how I learned it. I mean, Mickey did seminars, he did them in Boulder because I would bring all my patients. It was like we had patients that would want to come and be treated
Yes,
by
yes.
the master. I must say that, I got into doing this, that I went to a Chinese doctor in Boulder in the early 70s. And, I asked her if she would teach me. She got to be a friend of mine.
Yeah.
My first wife had cancer and she was treating her and I started getting treated. And I thought it was really good and I wanted to learn this more. And she went, white boy need to go to school. It was like she was like from a lineage, her grandfather had taught her father and her father had taught her. And,
Yes, yes.
when Mickey started learning acupuncture, he got to the place he was going to apprentice and they gave him a broom and he swept the floors and cleaned up for a month.
Exactly.
Just if he would stick around.
Yeah. Well, when I first started my apprenticeship in Japan, I literally went to a clinic and I said, because it was before I even started school over in Japan, and I said, look, I'll clean your toilets for free if you just let me watch.
Yeah.
And the doctor, Dr. Joe, he was like, yeah, sure, okay, we can do that. We'll test you out. It took me 3 months of 40-hour work weeks of cleaning the floor and cleaning the toilet and learning how to properly clean a toilet before he even paid me $1.40 an hour, so.
Him
Okay.
come. We did our certification class, the dozen of us. And then
Yeah.
Mickey decided we should all have a party. We all met in Hawaii and we all had to do presentations to each other. I mean, we did them up in front of a lectern and Dr. Kobayashi came with some of his students and he did, I always called it, he did acupuncture qigong because he
Yeah.
would.
He's
well,
really amazing.
He was, and the thing was, I went to Mickey's office for a seminar and Dr. Kobayashi was going to do the seminar. Mickey was going to translate. And we were in the office seeing patients and Mickey said, I have this gentleman I'd like you to see. And he said, I'd like you to go in and treat him if you would. I said, aren't you coming in? He goes, no, you'll do fine. And I went in and I did the pulses and did a treatment. It turned out it was Dr. Kobayashi.
Oh gosh. He was doing a sneak attack on you.
Oh, it was really, it was really unfair, doctor. And this was, I'd been studying for 15 years and Dr. Kobayashi said to Mickey, he'll be good one day.
So how did this all land with you? I know when I talked to Dr. Butch Levy, I was floored by the amount of information and wealth of knowledge and generosity to share that knowledge. I hope that you got the same from this conversation because he really is a huge source of information in the community and a great proponent of Japanese acupuncture and moxibustion. Again, if you're interested in learning more about Japanese acupuncture, of course, like, subscribe, hit the little bell, share this video to those who you think who would benefit from it. And then you're also more than welcome to go to shintouni.com and sign up for a lifetime membership with a course with me that will give you all of the foundational acupuncture and moxibustion skills you need, as well as the cultural, historical aspect, a lot of theoretical aspects, everything that you could possibly need to study with Dr. Butch Levy and seamlessly integrate all of his information straight into your practice. Now, if you're interested in learning more about Dr. Butch Levy, then you're more than welcome to go to drbutchlevy.com, and I'll link that in the description below. And then, as I said in the introduction, make sure that you go on Amazon, get his books on abdominal diagnosis. They are so good. I just can't even begin. Just really, really phenomenal books, wealth of knowledge, really simplistic, put together very well. And they're really easy to read, which I find is kind of hard to find in our medicine. So if you have any questions or comments, make sure to leave them below. I would love to hear that. If this video was awesome for you, just go ahead and type awesome in the comments below this video, and that'll give me direction to make more videos like this and introduce what Japanese acupuncture and moxibustion has become around the world.